This instructional video was developed by St. Luke's Episcopal School Biomedical Health Science Program following the guidelines from Johns Hopkins Department of Epidemiology and Infection Control. How to perform an anatomical surgical scrub before patient care. It is important that our students learn proper surgical scrub techniques before observing or shadowing in areas where procedures such as surgery or suturing are performed. This is to reduce the risk of site infections, which can be a serious threat to patient safety and recovery. In this video, we will demonstrate the brushstroke method. This procedure takes approximately 5 minutes when done correctly. Before beginning the surgical hand scrub procedure, you must gather your supplies. Remove any jewelry from both hands and arms, and sleeves must be shorter than 2 inches above the elbow. Inspect your hands to ensure that they are free of any cuts or wounds. Nails must not extend past the tips of your fingers, and nail polish must be intact without any chips or scratches. Remember, acrylic and artificial nails or any nails with foreign bodies are not allowed for sterile procedures at the bedside or in the operating room. Put on all personal protective equipment appropriate for the type of procedure you will be doing or observing. This will include a cap that covers your hair, ears, and any ear jewelry that you are wearing, a face mask that must cover all facial hair, and most likely it will include eye goggles or a face shield. You will need an approved surgical sponge kit with nail pick. Do not use one with betadine or povidone if you're allergic to iodine or shellfish. You will need soap from a dispenser, not a bar. You will also need clean paper towels within easy reach, but not where they will get wet. You will need several. Open the packaging and place it with the tear side up, close to the sink. Now let's begin. Once all items are assembled, turn on the water. Remove the nail pick from the package and clean under each nail. Dispose of the nail pick in a trash can beside the sink when you are finished. Then wet your hands. Next, remove the sterile sponge from the package and moisten it under running water by squeezing and releasing. With your fingertips together, use the brush side of the sponge to stroke the nails back and forth for approximately 30 times on each hand. The brush side of the sponge is only used on the fingertips. The sponge side will be used for the remainder of the scrub. Place your fingers and thumb side by side and scrub the palm for 10 strokes. Turn your hand over and scrub the dorsal surface for 10 strokes. Next, you will scrub the outside surface of your thumb from the wrist to the tip for 10 strokes. Continue to the other side of the thumb and both sides of each finger for 10 strokes each. Once an area has been scrubbed, do not go back. Now that you have scrubbed your hand, you will scrub the arm on the same side before moving to the other hand. Look at your arm and mentally divide it into thirds, beginning from the wrist to 2 inches above the elbow. To scrub the forearm, you need to apply 10 strokes to all 4 sides of each of these sections. Just like before, once you have scrubbed an area, do not go back. Once you have completed the entire forearm, repeat the process for the other side, beginning with the palm and fingers side by side for 10 strokes. Remember, once an area has been scrubbed, do not go back. When the second side is complete, discard the surgical sponge in the trash beside your sink. To rinse, begin with the fingertips, continue with the hand and up the forearm, moving in one continuous motion. Turn the water off with your elbow. If you touch the faucet or the sink during the scrub, you must restart from the very beginning. A few notes for our students before beginning to practice this skill at home. Do not use a povidone kit or one containing betadine if you're allergic to iodine or shellfish. Iodine will stain your clothing. Be very careful. Iodine may look dark gray on the paper towel, but it does not turn this color on your skin.